Hey guys, now we are going to discuss about classification and differential diagnosis of anemia. What is anemia? Anemia is a condition in which the blood doesn't have enough healthy RBCs. According to WHO, 1st May 2010 is the Scientific Anemic Day. Introduction about anemia. Anemia is an abnormal reduction in red blood cells. Iron deficiency anemia is the most common type of anemia overall. Asia has the highest rates of anemia in the world. The disease is most prevalent in North India. Anemia is the world's second leading cause of disability and thus one of the most serious global public health problems. WHO classified anemia in 3 different degrees. That is, in moderate degree, the percent of hemoglobin is 7 to 10.9%, whereas in severe degree, the percent of hemoglobin is 4 to 6.9. Whereas in very severe condition, the percent of hemoglobin is less than 4%. The most highly affected population groups in developing countries are pregnant women 56%, school-age children 53%, non-pregnant women 44%, and preschool children 42%. Anemia. Anemia is not a disease but a sign of some underlying disease. Anemia is not a disease, but a sign of some underlying disease. Etymology of anemia. An means without, emia means blood. So, the word anemia is without blood. The word anemia is a Greek word meaning lack of blood. Definition of anemia. It is a reduction in the oxygen transport capacity of the blood, a reduction below normal limits of the total circulating red cell mass. It is a reduction below normal in the volume of packed red cells. It is a reduction in the hemoglobin concentration of blood. It is a condition in which a person has inadequate amount of iron to meet body demands. Blood physiological aspect. Blood is a specialized connective tissue. Blood is a highly complex fluid in which formed elements are suspended. Those formed elements are RBC, WBC and platelets. The specific gravity of blood is 1.050 to 1.060. The viscosity is 5 times more than of water. The blood volume is 8% of total body weight. Erythropoiesis. It is a process by which red blood cells are produced. It mostly occurs in bone marrow. Presence of O2 in circulation, which is detected by kidneys, and they secrete hormones called erythropoietin, which stimulates proliferation and differentiation of red blood cell precursors, then activates erythropoiesis in the hemopoietic tissues, ultimately producing RBCs. History and physical examination. Diagnosis begins with a detailed history and physical examination. Those examinations are inquiry about dietary habits, ask about the medications that the patient takes, ask about menstrual patterns and history of heavy bleeding. A detailed physical examination entails examination of the abdomen for enlarged spleen or liver. A rectal examination may help detect rectal bleeding. Pregnancy may lead to anemia. Here are some diagnoses that are performed for anemia. They are complete blood count through evaluation of the patient, physical examination and medical history. On examination, the signs exhibited may include pallor, that is pale skin, mucosal lining, conjunctiva and nail beds. But this is not a reliable sign. There may be signs of specific causes of anemia like koilonychia, that is iron deficiency, jaundice in hemolytic anemia, bone deformities, leg ulcers, and pica. Pica, the consumption of non-food items such as ice, paper, wax or grass, and even hair or dirt may be symptom of iron deficiency, although it occurs often in those who have normal levels of hemoglobin. In this image, you can see the paleness of the skin. Signs and symptoms of anemia. The symptoms in eyes are yellowish discoloration. In central brain, there will be fatigue, dizziness and fainting. Whereas in skin, paleness, coldness, yellowish discoloration will be seen. In blood vessels, there will be low blood pressure. In heart, there will be palpitations, rapid heart rate, chest pain, angina and heart attack. Whereas in spleen, there will be enlargement of the spleen. Symptoms regarding respiratory system are shortness of breath, regarding muscular are weakness, and intestinal are changed stool color. Some common symptoms include irritability, fatigue, weakness, dizziness, palpitations, infection, and lack of concentration. Classification of anemia. Anemia is classified into two categories, that is, etiological classification and morphological classification. Etiological classification, where we classify anemia due to cause. The causes are impaired production of RBC, excessive blood loss, that is hemorrhage, and excessive blood destruction. In morphological classification of anemia, we have macrocytic anemia, microcytic normochromic anemia, and normocytic normochromic anemia. Let's start with impaired production of RBCs. Abnormal bone marrow leads to aplastic anemia and myelopathisis, which include myelofibrosis, leukemia, and cancer metastasis. Essential factors deficiency can cause deficiency anemia due to iron, vitamin B12, folic acid, etc. Anemia in renal disease, that is erythropoietin. Stimulation factor deficiency can cause anemia in chronic disease, anemia in hypopituitarism, anemia in hypothyroidism. Excessive destruction of RBC. Hemolytic anemia. This may be due to intracorpuscular defect or extracorpuscular defect. Intracorpuscular defects like membrane defect, which is hereditary spherocytosis. Enzyme defect is glucose 6-phosphate dehydrogenase deficiency, etc. Hemoglobin defect is thalassemia. Extracorpuscular defects are mechanical trauma to red blood cells include thrombocytopenic purpura, DIC, that is disseminated intravascular coagulation. Infections include malaria, chemical injury like lead poisoning, and animal poison like snake venom. Antibody mediated are transfusion reactions, erythroblastosis fetalis, drug associated SLE. SLE means systemic lupus erythematosus and mycoplasma infection. Excessive blood loss condition, that is hemorrhagic anemia. It might be either acute or chronic. The conditions in acute are trauma, scurvy, and hemophilia. It also includes accidents. In chronic anemia, lesions of gastrointestinal tract, that is bleeding peptic ulcer, bleeding piles, gynecological disturbances. Here I am going to explain you about the complete blood count and their normal values. The normal value of WBC is 4,300 to 10,800 cells per cubic millimeter. RBC count is, the range is between 4.2 and 5.9 million cells per cubic millimeter. The range of hemoglobin is approximately 13 to 18 grams. The values of hematocrit is 45 to 52% for men and 37 to 48% for women. Mean corpuscular volume is 80 to 100 femtoliters. Mean corpuscular hemoglobin range is 27 to 32 picograms. Mean corpuscular hemoglobin concentration is 32% to 36%. Red cell distribution width is 11 to 15%. Reticulocyte values are 0.5 to 2.5%. Causes, signs and symptoms and diagnosis of iron deficiency anemia. Loss or less iron intake may have symptoms like anxiety. Its diagnosis is pica. Increased iron demand have symptoms like irritability. The tests involved in this are low HB percent HCT, low MCV, MCH, MCHC and high RDW. Infestation with parasitic worms have symptoms like pallor, hair loss, mouth ulcer and angina. The diagnosis for pallor are peripheral smear. The diagnosis for hair loss are decreased ferritin. Normal values of iron indices in males and females. Serum iron. In males, the values are 65 to 177 μg per dl. In females, the value is 50 to 170 μg per dl. TIBC, that is total iron binding capacity. In males, the value is 250 to 370 μg per dl. Transferrin saturation. In males, the values are 20 to 50%, whereas in females, the value is 15 to 50%. Serum ferritin. The value in males is 20 to 250 μg per dl, whereas in females the value is 15 to 150 μg per dl. Megaloblastic anemia. Megaloblastic anemia is an anemia of macrocytic classification. Results from inhibition of DNA synthesis during red blood cell production. When DNA synthesis is impaired, this leads to continuing cell growth without division, which presents as macrocytosis. Let's discuss about some causes, signs and symptoms and its diagnosis. Vitamin B12 deficiency leading to folate deficiency. The symptoms are shortness of breath. The diagnosis in this are decreased RBC count and hemoglobin levels. The reticulocytes count is decreased. In deficient intrinsic factor, the symptoms are muscle weakness and the diagnosis is increased mean corpuscular value and mean corpuscular hemoglobin. Coeliac diseases. The symptom is diarrhea, normal mean corpuscular hemoglobin concentration. Is the diagnosis chlorhydria induced malabsorption. The symptoms are nausea. The diagnosis is the platelet count may be reduced. In inherited DNA synthesis disorders, the symptoms are pallor. The diagnosis is gold standard for diagnosis of vitamin B12 deficiency is a low blood level of vitamin B12. Sickle cell anemia. Sickle cell anemia is a hereditary blood disorder characterized by red blood cells that assume an abnormal rigid sickle shape. Sickling decreases the cell flexibility. Thalassemia is a Mediterranean anemia. Thalassa in Greek means the sea, emia means the blood, so thalassemia means anemia by the sea. Group of inherited blood disorders caused by reduced or absent synthesis of the beta chains of hemoglobin. There are two main types of thalassemia, alpha thalassemia and beta thalassemia. Alpha thalassemia occurs when a gene or genes related to alpha globin protein are missing or changed, whereas beta thalassemia occurs when similar gene defects affect production of the beta globin protein. Signs and symptoms and their diagnosis. Bone deformities in the face, severe anemia, fatigue, growth failure, shortness of breath and yellow skin. The diagnosis of fatigue is hemoglobin erythrophoresis shows the presence of an abnormal form of hemoglobin, whereas the diagnosis of growth failure is mutational analysis. Here you can see the inheritance of two carrier parents of thalassemia. The resultant offsprings are normal thalassemia trait and severe thalassemia. Aplastic anemia. Aplastic refers to inability of the stem cells to generate the mature blood cells. Aplastic anemia is a disease in which the bone marrow and the blood stem cells that reside there are damaged. This causes a deficiency of all three blood cell types. The three blood cell types are red blood cells, white blood cells and platelets. Let's see the causes, signs and symptoms and diagnosis. Due to chemicals, the symptoms arises are anemia with malaise, pallor and associated symptoms such as palpitations. And its diagnosis is complete blood count. Symptoms and signs occurs with drugs are thrombocytopenia. The diagnosis is renal function. The signs and symptoms of radiations are leukopenia leading to increased risk of infections. The diagnosis is electrolytes, liver enzymes, thyroid function test. The signs and symptoms of infection, immune diseases are reticulocytopenia and its diagnosis is vitamin B12 and folic acid levels. The diagnosis can only be confirmed on bone marrow in hereditary causes. Diet guide for anemia. Increase your intake of iron. Iron from animal sources is more easily absorbed than iron from plant foods. Vitamin C increases the uptake of iron, so add foods containing vitamin C like orange juice, tomato salad, etc. Lack of vitamin 12 such as beef, pork, eggs, cheese and milk. Increase your intake of folate by adding these fruits to your diet. They are green leafy vegetables, sprouts, broccoli and whole grains. Example, spinach, dried fruits and cereals are the best diet guides for anemia. If you have any doubts or want me to improvise, let me know in the comment sections below. Thank you.